The HIV Care Continuum. Recent scientific advances have shown that antiretroviral therapy preserves the health, quality of life, and life expectancy of people living with HIV. And people living with HIV who take medicine as prescribed and get and keep an undetectable viral load have effectively no risk of transmitting HIV to their HIV-negative sexual partners. These advances have formed the nation's approach to HIV prevention by ensuring that everyone living with HIV is aware of their status, receives the treatment they need, and achieves sustained viral suppression. We can reduce new infections in the United States. To help measure progress towards national goals and distribute HIV prevention resources most effectively, the Centers for Disease Control and Prevention, or the CDC, tracks the HIV Care Continuum. The continuum is the series of steps from the time a person receives a diagnosis of HIV through the successful treatment of their infection with HIV medications and achieving viral suppression. The steps of the HIV Care Continuum include diagnosed. Diagnosed measures the percentage of the total number of people living with HIV whose infection has been diagnosed. Linked to care. Linked to care measures the percentage of people receiving a diagnosis of HIV in a given calendar year who had one or more documented CD4 or viral load tests within 30 days of diagnosis. Receipt of care. Receipt of care is measured as the percentage of persons with diagnosed HIV who had at least one CD4 or viral load test. Retained in care. Retained in care measured as the percentage of persons with diagnosed HIV who had two or more CD4 or viral load tests performed at least 3 months apart. Viral suppression. Viral load is the term used to describe the amount of HIV in your blood. Viral suppression is measured as a viral load test result of less than 200 copies per milliliter of blood at the most recent viral load test during the measurement year. Monitoring the HIV Care Continuum. The CDC uses 2 different approaches to monitor the HIV Care Continuum. The prevalence-based HIV Care Continuum. Prevalence includes both people whose infection has been diagnosed and those who are infected but don't know it. Prevalence-based HIV Care Continuum describes the number of people who are at each step of the continuum as a percentage of the total number of people living with HIV, known as HIV prevalence. This approach allows us to monitor elements of the HIV Care Continuum by measuring the care outcomes among all Americans living with HIV. It can also monitor outcomes for broad populations. The diagnosed-based HIV Care Continuum. This shows each step as a percentage of the number of people living with diagnosed HIV. This approach gives us more detailed information about persons who are living with diagnosed HIV and provides a way to look at specific populations in the continuum. What the continuum looks like today. CDC data from May 2021 states an estimated 1.2 million people aged 13 and older were living with HIV in the United States at the end of 2019. Of those 1.2 million people, an estimated 87% were diagnosed. Approximately 66% had received HIV medical care. Approximately 50% were retained in care. An estimated 57% had achieved viral suppression. Our next video will highlight linkage to care services, a critical early step and successful HIV treatment that plays a key role in the care continuum. For more information about the HIV Care Continuum, please visit cdc.gov or hiv.gov. Are you looking for Linkage to Care services? Visit us online at miunified.org or call the Michigan HIV STD Hotline at 1-800-872-2437.